with my BFF and our dear dentist, Dr. Merlyn Matthews. And today we're going to talk about dental hygiene for kids. Okay, Ate Merlyn, go ahead and introduce yourself. Tell us a little about your kids and your background in dentistry.
Thank you, Ayo. Okay, thank you for this opportunity. I'm Merlyn Matthews. Background in dentistry. I actually specialize in orthodontics and also temporomandibular joint dysfunction. So when you have clicking in the ears or when you experience symptoms like migraines, headaches, unexplained, and you've been to an ENT, there could be something wrong with your temporomandibular joint. And I've been practicing for more than 35 years.
Ang tagal na, oo. And also,
Revealing my age.
alam mo, sa maraming milestones ng anak ni Dr. Merlyn, I've been there. So I've witnessed yung mga weddings. So tell us a little about their ages and what they do right now.
I have 3 kids. The eldest is 30 years old. Second is 27, and the third is 24. So they're 3 years apart. The eldest is now a doctor, licensed doctor, and the second graduate of business administration. And the youngest is graduate of MedTech, currently studying medicine proper.
Ayan,
She's
linya,
on her second year.
linya talaga to ng mga medicine ng kanilang family.
Unfortunately, no one followed dentistry.
No, parang dentistry, ang mahal pa naman ng pag-aaral sa dentistry. Okay, alam mo, one of the facts that is so sad is that most Filipino kids, when they visit their dentist for the first time, it's about extracting a tooth. And sadly, that was my experience growing up. Kaya traumatic. Kaya pag nakikita ko yung dentist, ayoko kasi alam kong makakaramdam ako ng sakit. Is that true?
Actually, that's a misnomer. Okay, if you visit the dentist regularly, you will feel less discomfort. You'll have no pain because if you visit regularly, we will be able to monitor the health condition of your teeth. Unfortunately, here in the Philippines, people will only remember dentists when they're feeling the pain.
Yeah.
And most often than not, it's too late to treat. If you visit the dentist regularly, all we do is just, do a quick check and probably do clean. But if you put it off until you feel the pain, then we could probably resort to root canal, and worse, we could extract the tooth.
Ayan na
It's really cheaper if you visit your dentist regularly.
Oo, nabanggit niyo po yung cheaper kasi minsan hindi talaga sinasama sa budget natin yan sa Filipino households. Not all, but marami. Kaya, what's the...
People can go regularly to Jollibee
Ayun,
or
yes.
McDonald's. Going to the dentist is just sacrificing one Jollibee. That's it. And that's a good every 6 months.
Oh, every 6 months, tapos one Jollibee sacrifice mo lang yan.
Yes.
Carry mo yan, moms, hindi ba? Pero question ko po, Dr. Merlyn, anong edad dapat dinadala first yung anak mo to see a dentist?
Soon as the tooth erupt. So, baby pa lang dapat, they have to get used because most parents would bring their dentist at, say, young age, mga 5, 6, and they're scared kasi they have this picture na the dentist will hurt them, and when they hear the drilling sound, they're scared. So I often advise parents to bring their toddlers, and just let them be comfortable.
So they get
sitting on
used
that
to
chair.
Yes.
Yun lang, and then we'll just have a quick look. They get familiar with the dental instruments, the mouth mirror. We're not gonna hurt them. We may just polish their teeth. So their visit to the dentist is more enjoyable, not traumatic.
I love that. Oo nga. Kaya binago ko talaga yan nung nagkaroon ako ng mga anak. So ngayon, Dr. Merlyn, ano ba yung magiging worst case scenario or the long-term effects for a kid na nagpabaya?
Well,
kanyang mga ngipin.
If you neglect your oral hygiene, you'll end up losing all your teeth. And some people would visit me in the clinic and they would say, Doc, bunutin na lang or just extract the tooth. They thought that's an easy way out. But once you lose the tooth, that's it. Then you'll have to wear dentures. And then if you don't keep a good oral hygiene, you'll end up with a decay, more decay than ever, because you're also not brushing your dentures, and there'll be food left on the rest of your teeth. So one by one, your teeth will be gone. Then you'll suffer with wearing dentures, especially if they don't fit or as you grow older,
Plus,
not-
yung confidence,
correct. Yeah.
nawawala
Yes.
talaga.
Yes.
Yung tipong gusto mo magsalita pero nakaganyan ka.
Most
Gusto mo tumawa,
Filipinos, you go like that.
Guilty!
I have a friend who said, I want to remove that. You know, when they smile, they should be smiling with their teeth, with their mouth. You know.
So, hindi pala siya pang Maria Clara kasi may tinatakpa ka palang may bumi siya. Ayan, okay. So, it's very important because long-term effect, imagine losing your confidence. So, syempre, mahihiya ka lalo pag nagdadalaga, nagbibinatay yung mga anak mo, magliligawan, manliligaw. So, minus talaga yun.
Yeah, and in my case, because my specialization is temporomandibular, most patients, if they lose their first molar, especially their first molar, they're all connected. And then you would experience the symptoms like headaches and you're up to your lower back pain because you have a temporomandibular disorder. And a lot of people are not aware of this. They go to an ENT, to other doctor, they think they have a nerve problem, when in fact it's just a temporomandibular, not just, it's a temporomandibular disorder. And that's because of losing one tooth.
Imagine, isang ngipin lang, pero that gives you a lot of pain and everything. Pero totoo ba yun na it can also lead to death, yung pagiging pabaya mo sa iyong oral hygiene?
In rare cases, yes. You know, I'm not saying a lot of patients die because they lose their teeth, but in rare cases, especially if they have heart problems, you know, or if not, if no antibiotic has been prescribed before the dental treatment, they could suffer from heart.
Oo. Tapos totoo ba yung may mga narinig ako dati, parang dami kong pabulatin. Yung mga binunutan daw yung molar. Tapos yung namatay kasi yung sobrang dumugo. Siguro mag-practice naman.
I think so. You know,
Yung wisdom tooth daw.
Even if you touch a nerve and there's severe blood profusion, there's a lot of things that we dentists can do. Or if you cannot really control it, you could take them to emergency room and it can be averted. But that's
too much na. Parang
I remove wisdom teeth on a regular basis, you know, and we could cut the teeth into half or into four, you know, depending on the level of impaction, but can be removed. Without
kung gusto ko rin makorek
turning
sa
to
akin,
fatal.
iniisip, maybe this is wrong. Is it right that yung ngipin talaga ng bata nagpo-fall off at a certain age? Like all?
Not all at the
Not
same
all,
time. There's a certain age of eruption. Usually, at the age of 6, when the permanent start erupting, the baby teeth or the not permanent teeth, the baby teeth will lead the rate of eruption. So it will lead the way on how the permanent teeth erupts. So when the permanent teeth started to erupt and you can see it crowning already, and the baby tooth still there, that's the time that you really remove it. That means nasungkit na yung ipin. So you take it out. But I don't take out baby teeth unless the permanent teeth is erupting because they serve as a guide to the permanent teeth.
Okay. Ito medyo sensitive yung question ko pero talaga nangyayari to. Kailan ba talaga nangyayari yung bad breath?
Okay, there are a lot of factors that will lead to bad breath. Okay. Of course, if you don't have a good oral hygiene and you have a lot of tartar and calcular deposits in your teeth, of course. And if you don't brush your tongue, and most people think that you just brush the teeth. You have to really brush your tongue.
Even the tongue.
Okay. And you have to use mouthwash. Each time after brushing, you use a mouthwash.
Ayun.
Now, if you have done all of that and you still have bad breath, there could be problems with, like, if you have ulcers. You know?
Okay.
So those are things that, or you've got a problem with your throat, you know, there's an infection there that's emitting bad odor. That can also be the case. So there's a lot of factors. So you visit the dentist regularly, and we will be able to advise you.
Exactly. Mahalaga yun. Dapat we will see our new BFF now should be our dentist. Lagdag natin yung sa listahan natin. Okay, ngayon, let's go to the to-do. What to do? Ano yung top 3 recommendations po natin sa mga moms para maalagaan nila yung kanilang yung ngipin ng kanilang mga anak? Including theirs.
They brush, they floss, and visit the dentist regularly. For newborn or mga babies, the toddlers, especially if the bristle is very hard, use soft bristles with toothbrush. You can just wrap your finger with cotton bud or soft cloth material, and then just go around the teeth of your babies, so that because you cannot shove the toothbrush straight away, especially if they're young ones. Just let them be comfortable with somebody
Parang
moving
yeah,
around
oo.
their mouth, and then slowly introduce. You don't need toothpaste straight away. You just slowly introduce just a little speck of toothbrush so they're familiar. With young ones, try to avoid minty toothpaste because they don't like the sensation in
Masyadong
their mouth. So
abrasive.
it turns them off whenever they're brushing. You just let them be comfortable. You're the mom, so they're comfortable with you putting your fingers inside their mouth. And you're like,
Yeah.
okay, brushing time, and make it as
As fun as
possible.
possible. Play up some music.
Yes.
Tapos wag pipilitin. Dapat yung hindi makaramdam ng parang
And make it fun, like,
pinuforce.
we're gonna buy you a new toothbrush, There's a lot of kiddie toothbrush that's designed in a nice way.
Oh, ang bagay na binanggit niyo po, and I think it's not really a common practice to many, is flossing. What is flossing? How do you do it?
Okay, if this is your teeth, you floss in between and you just slightly rest it. Just so you don't feel any pain. Okay, rest it on the surface of the teeth and then slightly on the gum, and then you bring it up. Don't shove it too hard because then you're gonna hurt your
Mag-bleed.
gums. That's what I said. If you don't know how to floss properly, you're gonna do more damage than good. Because once your gums receive a little bit of sensation, like they feel the pain, they tend to retract away. And if you constantly do that, then your gums will receive.
I see. Pero
If you
ba
just floss it there, you just pull the floss. Because if you pull it up, and sometimes when you have fillings, especially on the side fillings, especially if the contact is not good, you could dislodge the fillings straight away. So the purpose of your floss is to remove the particles that's on the teeth surfaces.
Okay.
And afterwards, you brush your teeth.
Brush again.
Brush. Before you brush, you floss. And then after you brush with the floss, just to check if you remove it properly, then mouthwash. Really important to mouthwash.
Wow, you've heard it right, ha? Yung order of doing it. Talagang hindi pwedeng nagbabrush lang ng teeth.
And then after 6 months, when you visit the dentist, because there are really areas that you're not able to clean properly, especially the back areas of your teeth. And that's our job. We have the machine to make sure that all the surfaces of your teeth are cleaned and there are no food particles that's hardened up and has become a calcular deposit. That's our job, to remove them.
Ayun. So, kayang pagplanuhan kasi nga 6 months naman in between. So, it's not really something very heavy if you make it your priority. Ito po, very quick, ano yung mga nakikita niyong wrong practices that moms need to stop doing sa kanilang mga anak that directly affect yung hygiene ng
Most moms would say, if you don't behave, I'll bring you to the dentist. Hala, like that. So,
Kilala ko yung mag-Halloween na
traumatized na.
daming candies and chocolates na
Dentist give you injection. Oh my goodness, So it's like, make it as pleasurable as possible. And please do not feed your kids, as a treat banana. I'll give you lollipop, especially lollipop. Yung mga boiled lollies, that's a no-no. Because the sweet stays, unless you can brush their teeth straight away. You give them chocolate and you brush the teeth straight away. Okay lang, but if you're just gonna bring it, give it to them, and then neglect their oral hygiene, then you're unaccomplished in making the dental health of your teeth bad.
Yay. We learned that. So, stop giving them candies as treats. Hindi talaga maganda yun. Meron pa po ba na parang maling
Or if you
ginagawa?
can give them treat, but make sure that you really, especially before going to bed.
Ayun.
Especially with bottle feeding. Now, do not give your children milk and then let them fall asleep. Make sure water is the last one that they sip.
Water is the last one
Water.
to sip.
Water is the last one.
And then, as soon as you eat, after that, brush agad.
If you can. If you cannot, then gargle with water in wherever, in the kitchen or in the comfort room, if you're outside in the restaurant.
Just to remove.
Gargle, just because once the food gets in touch with your teeth, it only takes about maybe 10-15 minutes for it to become acidic and starts attacking
Ay, ang bilis, no?
the enamel of your
Oo.
teeth. So if you gargle with water, then the pH more or less is controlled.
So
Doesn't
imagine,
become acidic.
if their kids do not brush, di ba, sa isang araw, gabi pa
Ay,
nag-brush,
Ako,
ang hindi na
for
pala ang
sure.
damage, no?
For sure. For sure.
And I'm sure ang dami yung questions and hindi natin masasagot lahat yan. Kaya go visit your nearest dentist. And I'm so lucky because I can just go easily through Dr. Merlyn's clinic here. Okay? So ngayon po, Dr. Merlyn, thank you so much for all the wonderful things you said about how important it is for moms to take care of their teeth and of course yung kanilang mga anak. Kasi nga tayo yung role model eh. We gotta tell them to brush kasi hindi ko naman nagtutoothbrush. Nakaka-ano naman yun. So ngayon po, let's hear the final advice from our B-mom, our dentist, Dr. Merlyn Matthews.
Well, as a dentist, I would really encourage you to visit your dentist regularly. As I said, it's very important. We value our health. We need to value our dental health as well. We should be the role model for our kids. So when we brush our teeth, remember to make sure that they also brush their teeth.
Yay! Thank you so much, B-moms! Until the next episode. Bye!